My name is Sebastian Williams, and here is my learning object 4. I will be talking about the health disparity between race and healthcare and how the COVID-19 pandemic has exposed these disparities. Specifically, I will be talking about the disparities affecting the average Black individual in America and how these disparities have negatively affected the Black communities in terms of health and how these disparities are rooted in systemic racism that has persisted for centuries. We will begin by taking a look at some data collected by the CDC relating to the high amounts of COVID-19 cases in the US. In the first graph in the top left, we see a ratio of death rates for certain age groups due to COVID-19. In every age group, the ratio is always the highest for Black people compared to white people, and then the second highest death ratio are for Hispanic people compared to white people. In the age group 35 to 44 years old, the ratio of Black deaths is 10 times greater than that of white deaths due to COVID-19. In the second graph in the top right, the crude death rate is about twice the amount for Black people than it is for whites and Hispanics. However, we should take into account the fact that younger people are more affected for Blacks and Hispanics than whites. So if we adjusted the graph by age, then we can see that the death rates are even higher for Blacks and Hispanics. In the third graph on the bottom left, we see that white people are much more likely than other races to make it to an older age. And in the fourth graph on the bottom right, we see that Black people are always the largest racial group to be susceptible to death due to COVID-19 in any age group, except it gets exponentially worse the older the Black individual is. So why are Black communities suffering so much from COVID-19 more than any other racial group? The answer is complex because there are many factors involved. However, they will all stem from systemic racism, and I will explain why. The socioeconomic status for many average Black individuals is typically low, especially in highly dense urban areas. Blacks typically have higher unemployment rates, higher poverty rates, and poorer living situations than whites. This low SES contributes to the lack of access to healthcare for Black people. This could include not being able to afford transportation, not being able to afford health insurance, and being unable to find the time to see a hospital when the average Black person is working 2 to 3 jobs to support themselves and their families. Why do Black communities have low SES? This is again rooted in systemic racism. Due to racial landmarking techniques such as redlining, many Black communities were forced to live in terrible conditions compared to their white counterparts. White communities typically live in wealthy estates or in suburban areas where the living conditions are nice and plentiful. Black communities were placed in highly dense areas such as the projects, and typically these locations were unhealthy because they were near factories or refineries that caused a lot of air pollution. They were placed there due to legislative laws redlining Black communities to be unable to live in better areas. The poor air quality caused many Blacks to develop health issues, including asthma and various cancers. How is this related to COVID-19? I will get to that as soon as this all ties together. Like I mentioned before, these Black communities were unable to leave these poor areas due to redlining laws that prevented them from being able to take loans from the bank to buy a new house. This was simply the government's way of preventing Black communities from leaving these poor areas and integrating into predominantly white neighborhoods. I would also like to bring back the low SES that Black communities have. Black communities already had low SES because of their living situations that they were forced to live in. The types of jobs these Black communities would have living in the projects were typically not very high paying. And so, due to the lack of money, many members of the Black community were unable to afford health insurance. This pushed these Black communities to avoid going to the hospital as best as they possibly could, even if they had terrible symptoms, all to avoid the outrageous hospital bill. This is where COVID-19 becomes extremely deadly for Black communities. Due to the poor SES and poor living conditions these Black communities were placed in without a choice, they are prime targets for COVID-19. As mentioned before, many Black people already have underlying health issues due to their poor living situation, and these living situations, such as the projects, are very dense in population. Therefore, COVID-19 can spread quickly from person to person as it is an airborne pathogen, and what makes COVID-19 such a deadly disease is how easily anyone is being susceptible to infection of the pathogen. While COVID-19 itself is not particularly a deadly disease, if it is in combination with other existing health issues, as is the case with most Black people, then the immune system can quickly become overwhelmed, and this can lead to quick hospitalization, and the results, as shown by the CDC, is death for many of these Black communities. Due to the poor air quality, Black communities have asthma and develop cancers that already weaken their bodies. The low SES also forces Black communities to eat poor quality foods as they can only afford these types of foods, and this puts them in diabetic situations and they lack key nutrients. The average white person living in the US has many resources to help them through this pandemic, including money, people of similar backgrounds, and the legislature designing laws to help improve their lives. The average Black person living in America typically do not have any of these resources available to them. COVID-19 has exposed the health disparities that have existed for a long time, and after connecting all the reasons why, we can see that the reason for these health disparities is due to systemic racism. This is why we should continue to focus on these disparities, as systemic racism has been rooted for a long time, and it will take a long time to dig these roots out. COVID-19 has affected everyone and taken many lives, but for the Black community, it has been especially hard due to the oppression they have been under for so long. This must change, and hopefully we can close these health disparities involving race soon.